One of the things that I tell a lot of my patients that are getting older and they still are not ready to have kids, what's wrong with you women? That we have a new technique now, we can actually freeze eggs.
Yes.
See, when I was coming through school, we couldn't, it was only embryos, but now they have new technique. I tell you, technology is amazing. So those women who basically are still unclear, or those women who do not have that significant other that they want to have a child with, they could actually now freeze their eggs,
Yes.
and then they can actually find the perfect guy, and then just hog time and grab a sperm. Kind of fun, and then basically go from there. Talk to us about now the new technique of freezing eggs.
Yes, the fact that we're able to collect and freeze a woman's eggs is great. That's one of the greatest advances that we have right now, and that's because, you know, if you do have a woman who's not ready to have a child, or she doesn't have a partner, or if you have a woman who's been diagnosed with a cancer or is undergoing ovarian or undergoing medical treatments that could be toxic to her ovaries, we now have the opportunity to basically do IVF for that woman, collect the eggs and freeze them, and then she can either go through her treatments and then come back and have the eggs thawed and fertilized later, or a single woman can meet her partner down the line and have these eggs available.
Wow.
What's great about that is that the fertility of the woman is based on the age that she was when the eggs were collected.
Wow.
So even if a woman is 30 and she freezes her eggs and she comes back when she's 40 to have them thawed and fertilized, these are 30-year-old eggs. And so even though she's older,
wow,
her chances of pregnancy and her fertility is based on the age that those eggs were collected.
That's
and not
something
her
I
present
didn't
age.
realize. That's amazing. So, you know, there's this whole now science where women in their early 30s and 20s that basically, you know, if they have enough foresight, say, look, you know, I want to take a bank of my eggs and freeze them just in case there's a probability or possibility something may happen to me in the future and something happens to my eggs. I still have a bank, so I'm banking my future on this. That's incredible. That's a whole, we got to talk about that on another topic, because that's a whole nother medicine thing.
Yeah, fertility preservation is huge. And
It's
we can do
huge.
this for men as well as women. If a man is diagnosed with testicular cancer or some of these other things,
Prostate cancer.
prostate cancer, they can bank their sperm prior to treatments, and then we can have, you know, good quality sperm available for later fertilizations also. So we definitely counsel women about this if they're just not ready, or if they're undergoing treatments that could potentially impair their fertility later. This is an option that we now have.
And this is huge because we know that there's an increased risk of breast cancer in getting younger and younger.
Yes.
And for those individuals who basically have had breast cancer or been diagnosed, we can possibly grab some eggs and freeze them, and when they get through treatment and so forth and so on.
Exactly.
Well, I want to move right now to a huge problem, and that's polycystic ovarian disease.
Yes.
And then we're going to finish up with Dr. MK's tips for a healthy sexual fertility life. Talk to us about PCO, Dr. MK.
PCOS stands for polycystic ovary syndrome, and it's the most common hormonal disorder in reproductive age women. The key features are irregular menstrual cycles, evidence of increased male hormones. Women will have oily skin, acne, facial hair growth, coarse hair growing over their abdomen, their chest, around their breast, and also having ovaries that appear polycystic when we look at them on an ultrasound. A lot of women with PCOS will have very irregular cycles where they only have a period every 3 to 6 months or so. And so obviously if they're not having regular ovulations or regular cycles, that's going to make it much harder for them to get pregnant. There are other health risks that are associated with PCOS in addition to just how it affects a woman's fertility. Many women with PCOS are overweight, and that's one of the common features with PCOS too, is obesity.
Back to that lifestyle again.
It's important. But what makes it harder for women with PCOS is that many women also have high insulin levels, and the high insulin levels can make it easier to gain weight and harder to lose weight. So even when women are not trying to get pregnant, it's important to be screened if you have PCOS, to be screened for insulin resistance with a 2-hour glucose tolerance test to look at insulin and sugar levels, and to treat those with diet and weight loss if the woman's overweight. And we also have medications like metformin or glucophage. A woman doesn't have to have a period every month, but at least every 3 months she should have a period to shed that lining. If a woman goes for many months without doing that, precancerous changes can start to develop within that uterine lining that just continues to build on itself, and these women are at increased risk for endometrial cancer or cancerous development and changes within the uterine lining. And so that's another important feature with PCOS, that we, even if a woman's not trying to get pregnant, we give medications to stimulate a menstrual period at least every 3 months, or put her on birth control pills,
right,
which can help with the male hormone levels, as well as make the cycles regular and prevent that buildup of a lining there.
Talk to me about metformin real quick. I know this is more medical than informative, but metformin, a lot of women come in, they're like, I'm on metformin, but I don't know why I'm on metformin, and they told me I have PCO. Give people an understanding what metformin actually does for PCO.
Again, metformin or glucophage is an insulin sensitizing agent. So the problem with insulin resistance is that you're not diabetic, so your blood sugars are normal, but you have to produce higher levels of insulin to keep driving that sugar into the cells and keep your glucose levels or your sugar levels in the normal range.
Yeah.
And so what metformin does is it makes your cells more sensitive to the insulin that you produce, so your body doesn't have to produce as much insulin to keep the sugars down and to be effective in how the insulin works with your cells.